Hi, good evening, Dr. Sumeet. And I think it's great to be back on the fifth episode of our India Health Talk. And today is a very interesting date because today is the International Day for Yoga. I remember this current government had started started calling 21st of June as International Day of Yoga on a day which is also the solstice, right? It's the longest day of the year, June 21st, traditionally.
Okay.
So, so happy International Day for Yoga to you. Trust you do some yogic practices to keep yourself healthy. But interestingly, I was debating this with one of my yoga instructors, previous yoga instructors, and he told me that for uh, for sedentary lifestyle, especially during our coronavirus days, right, the lockdown days, he said that yoga was a great life skill, right? Not like a therapy, but life skill. And he went on to say that there are asanas for back pain, which happens due to your sedentary, your posture, and the pranayams are good to strengthen your lungs and your airways that help you to build your immunity. And and we often hear about cases like what we had a couple of weeks ago when the actor Sushant Singh Rajput killed himself due to depression. And and uh, meditation, which is part of the yogic practices, is good for your mental health as well. So overall, it's supposed to be a full and full package. And I hope the world over people are taking advantage of it. But today I wanted to specifically talk about something else. While yoga is fine and all this is fine, um, I was at a webinar last week where we started talking about public health and ASHA workers and Anganwadi workers and PHCs. And the person I was speaking to, he said that you talk about health and data and AI and analytics and ML and all the wonderful things, but your data, which has to be captured, if you leave alone the hospitals, it has to be captured by these frontline workers. And for them, this is not just some training, but some life skill. It's a life-changing skill for them. So just want to get your perspective, Dr. Sumeet. How do you think about these ASHA workers? We haven't really talked about them. Nobody ever covers them. What's your opinion?
True. Thank you for raising this very important topic, Dr. Vikram, and a happy Yoga Day to you as well. I hope we all remain fit by whichever means we adopt. I try to keep myself fit by doing a little bit of exercise, not totally yoga, but I think I will indulge myself in yoga and meditation and other aspects. So it's a great way to keep yourself fit. Now, talking about ASHA workers or these ancillary workers, I think they play an integral part of our healthcare workforce for the simple reason that I think 85% of our population live in rural areas. Okay, and there they are not able to access the kind of healthcare services we can in tier one, tier two, or even tier three cities, and hence they come to the forefront. Okay, my panchan for stats. I will just read out. I had some stats that we have around 25,000 primary healthcare centers, some 5,000 community health centers, and it's a known fact that our doctors are not sufficient enough to handle the entire population. Okay, and hence these ASHA workers or Anganwadi workers, they play the paramount role in our daily lives, maintaining the healthcare, especially in the rural areas. And in India currently, there are around 900,000 ASHA workers who act as bridge between the government and the people due to a human resource shortage in the healthcare system. And these are basically the people who are working for the nation in these challenging times, truly, because the kind of payment or the kind of resources they have at their disposal is not that great. Okay, so I feel that the ASHA worker deployed by our central government or the state governments, okay, they have to be trained well. Okay, they have to be given all kinds of necessary equipments and the necessary training to help us take our healthcare services to the next level. But that's not happening. That has never happened. So I feel that a lot of work needs to be done in that aspect. So what's your take?
Yeah, it's fascinating. So I was watching this web series on Amazon called Panchayat. I don't know if you've seen
Hmm.
it. It's a I've just reached the third episode,
Mm-hmm.
and it's not related to healthcare in any way, at least till what I have watched.
Hmm.
But pretty much sums up the issues in a village, right? Where so I give you a small example, and I digress slightly. He goes out to buy something to eat because he hasn't had food, and whenever he asks for directions, they ask him, "Where are you from? What are you doing here?"
Hmm.
And he says, "No, I'm the secretary of the panchayat," right?
Hmm.
And they say, "Oh, okay, 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 you can go this way." So while this might in isolation looks like a small incident, but in reality, what it means is at that level, at the village level, at the community level, they find it very difficult to trust outsiders
Hmm.
who's not from them. And this Asha worker or Anganwadi worker that we speak about is mostly a part of the community. It's somebody who's local, right? So they trust that person for whatever reason. And I think there is a big misstep that has been taken by successive governments when it comes to health. When we have not fully, developed this cadre, while we continue to invest in CT scans and MRIs and
Hmm.
artificial intelligence to detect oncology and cancer and stuff like that.
Hmm.
You just mentioned that they are paid 1,000 rupees a day or a month, sorry, for
True.
coronavirus related work. Maybe that's in addition to what they get paid, but the pay is low. There is no system to keep them updated on what's happening in the country or in the field of medicine. And also the stock pool we pull them from, right, is not very sophisticated either. But they have one thing that you don't have. They have the trust of the people. And so I think at every stage, whether it's the government, educational institutions, schools and colleges, I think we need to train this cadre of people. Not train again. Somebody argued with me, training is not enough. You can train somebody on Python or MS Word, but you can't train a person from the community to understand what is healthcare. But you have
Hmm.
to change their life and make this attractive for the very smart, enterprising individuals from the community to come in. I don't know. What are your thoughts on that?
Yeah, true. See, for me, ASHA workers, they are an integral part of the institutional healthcare structure in India. Okay, but I have read many a times, in various reports and news items, and when I talk to a few of my colleagues, they have been treated as subpar by successive governments, and even from the other healthcare workers. There has been recent case in this COVID crisis that they have been ostracized also. Okay, and they do not receive much support from government. And there was a report, I think in 2016 or 2018, there was a promise made to these ASHA workers and other activists that the instances of part or delayed payment will be reduced. Okay, due to which many of these ASHA workers have to find secondary employment. And but it has not come to the forefront. It's still on the paper, and I think 60 to 70% of the promises that were made to this group of people, the ASHA workers, they have not been fulfilled. But still, they kind of hold a huge load of workload on their shoulders, and it has increased constantly. Okay, so I believe that, of course, we need to focus upon the technologies, new hospitals, but we have to invest a lot on healthcare personnel, and it's not about doctors or trained nurses. These ASHA workers play a critical role.
Yeah, I'm just thinking. See, it's economically it makes more sense if you ask me. If I can treat a local, let's look at this way, right?
Mm,
You and me both are in the field of medicine.
mm,
That local problems are very specific. Local health conditions are very specific, and they're very endemic to that region, right? An ASHA worker from a region would know those conditions. So in a way, we can keep these people, these professionals trained, motivated. Again, I'm saying trained, but I'm saying updated,
mm,
motivated. Pick the right kind of people, pay them on time, give them a good financial incentive to invest in preventive health, and you'll see that we may not need so many hospitals then.
true.
I think this structure, whoever built this structure, right, the ASHA workers, the Anganwadi workers, I think there was some thought given to it. And if you look at it, it's very much in line with the Boer Committee recommendations of 1943. When he talked about size of a PHC, he did talk about a few doctors, but most of it were dais and health
Yeah.
workers and assistants. and uh, and pretty much that cadre is the one we need today.
Hmm.
You know, and any startup that can help us identify, groom, keep these cadre updated is the one that probably will make a lot more sense in investing in, not only from the public health perspective, also from the government perspective. I don't know if you
Absolutely.
had any thoughts on how startups can get involved.
True, true. I think their advantages are multifolds, okay, and especially around maternal health, okay, and providing care for minor ailments, they play an integral role. And even I feel that they can provide the right information in terms of disease spreads like epidemics in rural areas. I don't think so. People are doing contract tracing or using analytics or data points in rural areas, and these are the people, these are the human warriors that can provide that kind of information. So definitely you need to have the right kind of program and infrastructure to support them. Okay, recruit more, I would say, get more ASHA workers or similar kind of workers into the system, get them on a particular payroll, give them all the benefits. Okay. I also believe that you raised the topic of startups. I haven't seen any startup who is working in this domain. Most of the startups in healthcare, they connect a doctor to a patient through teleconsultation or online chat or something like that. Okay. But a startup which could run a training program in collaboration with our health ministry could do great for the healthcare system in India.
Good. I think that should be our next session. We should,
Yeah,
in the next coming weeks, I think we should ask startups this question: what
yeah,
are you really doing? If you're
absolutely.
creating another app to connect doctors with patients and monitor health, please
Hmm.
don't bother. There are plenty of them,
Absolutely. And
right?
and as
But
your
you are,
yeah, as your favorite topic is, why the elections are not fought with healthcare or these things in mind. I think this is a very important topic. How many ASHA workers or how many ancillary workers a state government get put in districts and in rural areas? Okay, they should have targets in mind. How do you evaluate the performance of these ASHA workers? Is there a specific structure to it? I'm not sure. So all these things should be mentioned in manifestos and plans for 5 and next 10 years.
I agree. And if the number of ASHA workers will increase, then it'll become an election issue. Trust me. They are voters as well.
I know. I understand what you're saying, but that's important. I hope this crisis has provided us things to ponder upon, and this could be one of them.
Sure, Dr. Sumeet. That's perfect. It is again a great session. I think I hope some of these startups are listening to us, some of the government officials are listening to us. But I think this is an area that we need to invest in. And hopefully,
Yes,
we would have made a difference. Like we did make a difference with our other session that day. And immediately there was a spate of activity. What can you
absolutely,
say?
absolutely. You talk to clients on daily basis, Dr. Vikram. But what do you think? Do they talk about ASHA workers, or is it totally about AI
No,
and they do not?
nobody's talking about data workers.
So
That's a brutal truth.
yeah, even the
Everybody's talking about
mm,
see, it pre at least 2 3 years ago, it used to be a lot
mm,
medical tools. I think that was the hot topic.
mm,
About 3 years ago, that started changing, because people started talking about tapping the potential within the country. But again, it's about AI, ML, diagnostics.
mm, mm, mm,
How can you, identify, diagnose, improve outcomes, all that. But no discussion on ASHA workers ever. Actually, there's no discussion on public health at all.
mm.
So I
True.
think that's an area of concern.
Great. I hope some transformation happens in next 3 to 4 years.
All right. So have a good evening, and thanks again for this lovely chat.
Thank you, Dr. Vikram. Have a wonderful day.